Both robotic and laparoscopic surgery are minimally invasive. So these are using smaller incisions and smaller instruments to do somewhat maximally invasive surgeries on patients. So to do this, we have to create what's called a pneumoperitoneum. This is where we fill the abdomen with CO2 gas to allow space to operate in. So using a traditional laparoscopic approach, you've got a camera that's driven by an assistant, and then you've got the freedom to use two hands to operate. So when you're using the two hands laparoscopically, you've got straight sticks, and you're essentially only able to move left, right, up, and down. But when you're doing this robotically, you're able to drive the camera for yourself, not requiring an assistant, and you've got the freedom of motion in a 360-degree fashion with wristed instruments. Gallbladder surgery is the most common general surgery that most surgeons do. So I think there's some strong advantages of doing this robotically versus traditional laparoscopic surgery, but also appendectomy, so removal of the appendix, and then small bowel and colon surgery, whether it's benign or malignant disease, and then also hernia surgery, whether it's hiatal hernia, where you've got the stomach slipping up into the chest, or inguinal surgery down in the groins, or ventral or incisional hernia on the abdominal wall. Essentially, everybody's a candidate for minimally invasive surgery. There are times that you may have to convert to a more traditional open surgery, but this is typically in a patient that's had multiple abdominal surgeries in the past and has extensive abdominal adhesions, or if there's an intraoperative complication, whether from bleeding or from intra-abdominal bowel injury. General surgeons are fully trained to operate on children. It's common for us to perform appendix surgery on children. Actually, the bell curve is more towards the younger ages, but we also do some other surgeries on children as well, that being hernia surgery or potentially some skin type surgery. We perform essentially all the surgeries associated with the abdomen. So surgeries on the colon, the small bowel, the gallbladder, the appendix. We perform surgeries associated with the liver, potentially the pancreas or the stomach. We also perform some skin surgeries, those like basal cell surgery for skin cancer, squamous cell, or melanoma. And then we perform breast surgery as well.